Pfizer has submitted its data to the FDA, and it means that we could see approval in just a matter of weeks. And it's partially in thanks to 3 kids that you're about to meet. They came here to Upstate Hospital back in May, hoping to be part of not only the trial, but to be part of something that could make a difference. When Big Sister does something, it doesn't take long for the younger siblings to copy.
I'm pretty sure the twins were a little nervous. They don't do that great with shots and stuff like that.
So when 11-year-old Layla Meany signed up for the Pfizer vaccine trial, it didn't take long for her little twin sisters, Stella and Cassidy, to follow, even if they were a little scared. Once their historic injections were in the books, the kids got back to playing, doing homework, and eating snacks.
And I can understand the hesitancy as a mom of saying it's okay to, try things out on my children, but I don't think I felt that way.
While some were still hesitant about the vaccine, this was an easy choice for Cheryl and Jason. Knowing how safe and effective it is for adults, they jumped at the chance to get their kids protected while helping others.
And the possibility of my kids getting sick from this virus and potentially even worse, I think weighing that against having them involved in this trial, it was a no-brainer.
Even though they may have gotten placebos, there's a sense of relief. Jason worked in a COVID ICU and has seen firsthand what the virus can do.
The more people that get vaccinated, the better off we're going to be in the long run.
The lead investigator in this trial at Upstate says the data shows this has produced a strong immune response and is safe for kids.
Well, there is vaccine hesitancy for this age group as the vaccines undergo authorization and ultimately FDA approval. There's also a lot of parents, many parents out there that are eager and interested to get their children immunized.
And they're likely to have the chance to, in part thanks to these 3 sisters.
I'm knowing that I can change the world and make it a better place.
Dr. Domachowski says once Pfizer actually submits for emergency approval, it's going to take a few more steps for it to actually be approved. He thinks that could happen by around Thanksgiving. And then to give time for Pfizer to actually produce and ship out these new vials, because it's going to be a smaller dose than we've been getting as adults, he thinks that these shots will actually be available by mid-December. Matt?
Be about a third of the dose, they say. Connor, thanks for introducing us to that family, and we want to thank them for taking part to help out so many other school kids across the country.
Today, Peggy Riccardi is breathing a little easier, walking with her 4-week-old daughter Beverly on a beautiful October day. This time last week, Beverly's RSV symptoms were getting worse.
She was having a lot of trouble breathing, so obviously I wanted to get her to the ER.
She says because Beverly is a newborn, they got attention quickly, but actually getting admitted was another story. Waiting in the emergency room for 18 hours.
They said that the hospital was completely full, that we had to wait for discharges, which meant that we were taking up a bed in the ER.
They're not the only family to experience something like this. Part of a massive staffing shortage that the emergency medicine director here at Upstate says has snowballed into a full-blown crisis.
Emergency medicine and emergency departments are kind of the canary in the public health coal mine.
Dr. William Paolo says a major staffing shortage has loomed for the better part of 2 decades. The pandemic was the tipping point.
The hospitals are in the middle of the worst crisis I've seen because of the lack of staffing to be able to function at the baseline of how you'd function for a hospital.
Older staff retired in high numbers as COVID struck, with fewer younger or new professionals to continue to fill the gap. Hospitals and parent companies are now engaging in bidding wars to snap up those left in the talent pool. The most recent issue, New York State's vaccine mandate, forcing Upstate to suspend 113 staff members who chose not to get the vaccine.
So all of those combined to make the perfect storm of this crisis that you're in now.
He says the hospital is still here to help, and he doesn't want people avoiding emergency rooms when they need it. Attending to the sickest patients first, knowing some, for now, will face major wait times.
What it feels like is that each day we walk in and we just hope that we can get out of the other end of the shift doing as much good as we can with what we have.
Saying the healthcare system itself needs an overhaul to fix the issue, with nurses still on hand facing major burnout. In Syracuse, I'm Connor White. For nearly 2 years, government response to COVID-19 has completely thrown off children's lives. Dr. Robert Draker at Summerwood Pediatrics has seen it firsthand.
If the children, to begin with, have some degree of anxiety or a mild depression, it only gets accentuated when we're living through times of uncertainty like this.
Even as schools reopened and cases briefly dropped last summer, mental health calls didn't stop.
Record numbers of calls for therapy, calls for services.
Family psychologist Dr. Tanya Pelletieri says the mental health resources aren't there to properly handle this crisis. In her own practice, insurance companies recently slashed reimbursement rates by up to 20%.
At a time when we need more people doing what I do. I haven't gotten a pay raise from an insurance company in the 20 years that I've worked.
Without the proper resources to address the current mental health crisis, doctors are seeing the impact in the emergency room.
We're clearly seeing more children going to the ER because of statements made that they thought about hurting themselves or unfortunately even killing themselves, whether they have a plan or not. We all try to take that very, very seriously.
According to a CDC study, suspected suicide attempts that led to ER visits went up 31% in kids ages 12 to 17 during the pandemic. For girls in the same age group, attempts went up by about 50%.
When you admit a child for suicidal ideation or attempt, the child has a 24-hour-a-day sitter that's right next to them per patient. So it's a very big drain on the hospital resources as well for these children.
Even if the pandemic phase of COVID-19 ends, experts say the mental health crisis will continue.
We really need to prioritize kids' mental health, families' mental health.
Mental health is a disease. It's not just social comment on what's going on in our society at the time. It's truly a disease.
Dr. Draker says the same resources used to fight COVID need to be turned to improving mental health. In Syracuse, I'm Connor White.